Nobody expects the Spanish Inquisition.
Likewise, no one expected the Spanish flu pandemic. And the coronavirus. And the plague, and Kanye's insanity, though he's been going insane for a long time. His children, North, Saint, Chicago, and Psalm, can confirm. Anyway, today we will figure out why the flu is Spanish. Does it play castanets? How humanity managed to overcome it, and most importantly, what lessons we can learn from the tragedy that happened more than 100 years ago. Wipe your hands with alcohol, yank the bell, and sharpen your combat syringe. Let's go! The First World War is often called the Trench War. The goal in such a war is not to seize the enemy territory, but using artillery and infrequent attacks, exhaust the enemy entrenched for many months or even years. Being in the trenches during 1918 was not that much fun. The romance of war somehow was not there. But the stench of unwashed bodies and excrements were. A lot. Some say German gas attacks were not that toxic. Hunger, unsanitary conditions, and overcrowding of people led to the emergence and spread of the most catastrophic infection that our planet has encountered. When the pandemic broke out, frightened people immediately rushed to blame others. In Brazil, the new disease was called German flu. In Senegal, Brazilian flu, and in Poland, Bolshevik disease. The name Spanish flu actually offends innocent siesta enthusiasts. The disease did not originate there, but rather somewhere in the trenches of France. The countries participating in the conflict were in no hurry to disclose the number of patients during wartime. That is why the first official statements about the pandemic began to come from the neutral Spain. This is how unpretentious Bolshevik disease became the Spanish flu. No bullfights involved. So why was the Spanish flu so terrible? Can it defeat COVID-19 at mortal combat? As devastating as the current pandemic is, the Spanish flu pandemic remains the worst in world history. By the time 3 waves of the Spanish flu swept the world in 1918 and 1919, at least 50 million people had died, including 675,000 Americans. By comparison, the 1957, 1968, and 2009 flu pandemics took an estimated 225,000 American lives and 3 million people worldwide. Why are we sharing all these awful facts? Because it was damn awful that time. But there is also a silver lining here. Let's highlight 3 lessons that the Spanish flu taught us, and at the same time compare it with COVID-19. Science rules! Of course, comparing these 2 horrible diseases is not entirely correct. The thing that killed people then was unknown. Microbes had been studied for decades. So scientists quickly realized that these very microbes were transmitted from person to person through respiratory system when coughing and sneezing. But viruses weren't discovered until the 1930s because we simply didn't have microscopes to see the little rascals. As a result, testing was not done simply because it did not exist. Moreover, the Spanish flu was more contagious than COVID-19, caused symptoms much faster, and was more deadly. And unlike COVID-19, which poses the greatest danger to older people, the Spanish flu affected young people. People in their prime were dying one after another, and panic and fear worldwide only grew. Nobody was ready for this. On the other hand, in our time, the genome of the new SARS-CoV-2 virus was very quickly deciphered, and intensive research on specific drugs and vaccines is currently underway. So, in medicine, today we have advanced much farther than in the days of weak microscopes. Social distancing works. A phrase that many of us would not have heard until March this year is social distancing. How was it before? Why are you sitting at home all the time writing scripts, playing games? Go out into the streets, talk to people. At the beginning of 2020, all introverts exhaled. Now you can stay at home for an official and very important reason. We're encouraged and, in some cases, forced to stay away from other people. Thank God they figured it out in 1918. Schools and institutions were closed, public events were canceled. For example, the Cheltenham Boys' School in England simply locked students and staff inside the school building. Meanwhile, across the Atlantic, New York City Health Commissioner Dr. Copeland introduced measures to reduce contacts in the most populous city. Limiting what people can do is always hotly debated, and the constant debate in the press about the need to wear masks in public places and public transport is far from a contemporary issue. For example, the San Francisco Opponents League in early 1919 was supported by several thousand people who opposed wearing masks. In our time, thanks to the timely actions of many countries' governments, it was possible to achieve results that were unprecedented in 1919. And although the population tries to adhere to the established rules, many people violate them, as if their lungs can digest anything, as if they're Superman. But such irresponsible behavior can lead to the second wave.
A second wave of the coronavirus outbreak in the fall.
The second wave of COVID-19.
Will there be a second wave?
Yes, it can happen. The Spanish flu taught us that viruses spread in waves. The second wave of Spanish flu in the fall of 1918 was much more deadly than the first, as huge numbers of soldiers returned home from the war, spreading the disease as people gathered to celebrate the victory. In Canada, the pandemic quickly moved westward, devastating communities due to an acute shortage of doctors. A total of 50,000 people died in that country. In the United States, the second wave of the pandemic struck just as students began a new semester. Many of whom had just returned home from the front. By October, the university was disbanded to treat the sick and prevent further infection. The next winter, the third wave hit. This led to the creation and consolidation of a plan to fight the pandemic. It encompassed the 5 main pillars of the public health response we have today: ensuring a uniform and coordinated response, issuing warnings, disseminating evidence-based information, monitoring disease and statistics, and tracking the spread of the pandemic by countries. The Spanish flu pandemic is a reminder that the right decisions made by leaders of nations, properly informed by science and basic public health principles, can be critical. Today, we must remember that neither COVID-19, nor the Spanish flu, nor the plague, nor the TikTok epidemic of bloggers should frighten a society in which the goals of equality, social justice, and human rights are at the forefront. Someday, we will become such a society. In the meantime, stay at home a little more, because the new Xbox won't play itself, right? Brainframe out.